you have this field of nursing, and then you have this whole field of legal nursing. It's like just as big, right?
Yeah.
It doesn't get any smaller, which is fascinating. Once I discovered it, I was like, oh my God, there's a whole nother world.
Hey guys, welcome back to Resilient Nursing. I'm so excited today. We are going to talk to a legal nurse, and her name is Stephaney Edwards. She's going to give us all the details on what it's like to be a legal nurse. Hi, Stephaney.
Hi, how are you?
Doing well. How about yourself?
I'm doing good. Thank you. I'm excited to be here.
I am really excited to jump into it, but first, I want to know more about you, and can you share our viewers what your story is?
My story about how I got into legal nursing, that started quite a few years ago, actually. So I've been a nurse for about 13 years, and legal nursing came across, I would say at least eight or 9 years ago, the idea of it. And I actually saw it in a mailer. And one thing that's interesting is once the idea of legal nursing came into my head, it never really left because it
Uh,
opened up doors and I realized I had options. I was always into law. I loved law from the beginning. And then I was also exposed 6 months into my nursing career to a legal circumstance where I was
oh
deposed.
no.
And I don't know how many people can actually say they have been deposed in their career, but I got lucky. And in the first 6 months, I was being deposed related to a patient we cared for in the ICU. But it was a real eye opener for me. And really, I mean, since the beginning, I've been interested. Legal nursing really was just an option for me to have the ability to create a different environment for myself and give myself a lot more options. But really, I came across it, it's been about 8 years that I came across it and learned a little bit more about it and decided this is like right up my alley, man. I get to do like incorporate law and nursing. I mean, it was perfect. It was the best combination. And the fact that I could already do what I'd been doing, like screening medical records, I mean, it's what we do all day.
Yeah.
Nurses, we make the medical records. So the fact that I got to actually incorporate everything I'd already learned, I mean, people say, well, that sounds too good to be true.
Mm.
And it's not too good to be true because it's real.
To me, it always seemed like I've heard of legal nursing, but it seemed like too far out of reach of like, is that really something that is
Mhm.
possible? Is that something that is enjoyable even? Like the thought of looking at cases, like what's your opinion on, well, first, what does a legal nurse do in reality? Because I know we have maybe the ideas or stereotype of what we think it is, but what is legal nursing really at its core?
So legal nursing is essentially, our scope is to really bring our medical expertise to the attorneys.
Mm.
And so they are the legal experts. And there's an awful lot of medicine and law that intertwines. I mean, think about what lawsuits are about, right? But you do a lot of medical record analyzation, and it's really to help paint that picture for the attorney and educate them, right? When they're
Mm.
reading and screening these medical records, we can blow through them and put the picture together because we understand the terminology.
Yes.
While they have to stop and look everything up, it just makes a lot more sense. And
Mm.
so, as a legal nurse, and this is what is super fascinating to me is that we find those little missing pieces, like finding the needle in the haystack.
Mm.
Uh, Catching and picking up on little things and events that happen that someone in law may not notice
Mm.
because it doesn't trigger something for them. Whereas for us, we're like, no, hold on a second. That's not right. Something else was supposed to occur first. I need to go look for XYZ.
Mm.
We also help them write reports. We help
Okay.
them find testifying experts. We can help them organize medical records. We can help them with DME services.
Mm.
um, there's so many things a legal nurse can do. Chronologies, timelines, fact sheets, and summaries. I
Mm.
mean, I have a list. The list is long, and there are really a lot of opportunities where you can integrate yourself
Mm.
with an attorney, even throughout their process, like through their litigation process. Like requests for production or interrogatories, and like having those statements, those questions, to send back and forth through defense and plaintiff, things like that, that you can actually get involved in. Because from a nursing perspective, you can help them identify what records are
Mm,
needed, what's missing, what events should we focus on. If the case is about a heart attack, however, there's an event that preceded that has substantial importance,
yeah.
or maybe something in the medical record they wouldn't have noticed before. It's just really important for us to be able to point that out to them so we can really paint an accurate picture and give the attorneys an opportunity to learn and grow as well. And that's something I do with my clients. I love giving them a lot of the education and
Mm,
the knowledge and explaining things in such a way where they're like, okay, that makes total sense. And usually they have a personal instance that they can relate back to it. And that's when I think they start to realize how important it is to have a legal nurse on their team, to help take some of that time consuming workload off of
mm,
them. And that's really what it's about. I mean, attorneys spend a lot of time, their paralegals spend a lot of time screening medical records. And undoubtedly, nurses, we just by default do it faster.
mm,
And, some people think that screening medical records is boring, but I'm telling you, if you like research and you like to
mm.
find those missing pieces and you like to put the puzzles together, I mean, you're not sitting there like reading every word, right?
Yeah.
It's exactly how we look through our records at the bedside.
Yeah.
And that's exactly what you're doing. You're just doing it from, an actual electronic medical record, and helping put together a picture. That's, to me, it never gets old.
Yeah.
And the fact that we still get to help people and help attorneys, like there's so much
Mm,
gratification in that. And we're educators. So educating attorneys and educating people on their team and paralegals and working with the team, helping the plaintiffs, right? Or if you're working in defense and defending the hospital or a client, I find a lot of gratification in being able to paint that picture
mm,
accurately so that the attorney can see, what I mean, all angles of the picture
mm.
and be able to it just better suits them for their case
Yeah.
and gives them a lot of knowledge and background that they may not have been able to pick up just from reading a medical record.
Mm. And part of the story that I feel like you would get to tell them is with other things that are going on that then contributed to it that may not necessarily be in the record. So like if their nurse says, well, this was going on, then you could be like, oh yeah, duh, of course I would have done the same thing, even though it wasn't strictly like, what are you doing? If she's prioritizing because another patient was coding, like of course that would have been a little late, or things like that, that when you just have
Yes.
that one singular patient's chart, you wouldn't know.
Yeah, there is a lot that goes into that. And that's part of painting that picture. If it's meeting a standard of care or not meeting a standard of
Mm,
care, but being able to say, this is what the defense is going to say. And they're going to say it's because the nurse is coding another patient,
mm,
that the patient didn't get their cardiac medicine right at 7 p.m. or 9 p.m. You know what I mean? And helping the attorneys understand and see all of that, see
mm.
it from all angles to really get a 360 kind of point of view,
Yeah.
because we're really good at that, man. Nurses,
Mm.
we're always really good at like playing devil's advocate and just thinking the completely opposite on like a whim to just, well, what if this, what if
Yeah.
this, like we are very much the, what if this happens? What do you do? What if X happens? What do you do?
Mhm.
You know what I mean? And so our brain is really like already programmed to do
Yeah.
these things. And we just help, we're like translators. Just
Yes.
help translate the message so that, in a way that attorneys can understand it, and
Mm,
then to also do their job so they can advocate for their clients appropriately.
mm,
And, it's not always about just finding what the attorney needs. There are times where I have screened cases and told attorneys, I know you think this has merit, but I don't agree with it.
mm.
And that happens. And that's one of the beauties of being able to work with attorneys is they bring you a case and they're like, this sounds like a really good case. Tell me if you think it has merit, tell me if it's valuable. And you get to keep non-meritorious things out of the legal system. Things that,
Mm.
I mean, sometimes people want to sue for what reasons I wouldn't agree with,
Yeah.
and that's what I'm there for, is to offer my opinion. And if I say I don't agree with this, I tell them.
Mm.
That's one of the things that attorneys really like too, is they really like honesty. They want you to be 1000% honest with them. Whether they love you, like you, or hate you, they still want you. They still value your honesty. So that's one of the best parts about it, I think, is that I get to be honest and tell my opinion and tell them, if you would like another opinion, I can send you to another legal nurse. Look, I know a whole network of them, which is also the other really cool part. It's not a lonely role. You get to be a part of a network and a team. Can it get lonely? I mean, it can if you allow it, but you don't have to. You can be a part of a team and a network. You can subcontract from other legal nurses. I reach out to other legal nurses. I'm not a pediatric specialist, but if my attorney has a case that involves peds, I'm like, hey, I have someone for you. Don't worry about it. I'll bring a specialist in, and I'll subcontract out to that nurse who does peds, right? Who does cardiac, because I know that I could do it, but I'm not the expert, and I know someone who's better at it than me. Let me get them involved too. And attorneys really like that. It's almost like, oh, I get to have all these minds on my case to help me out. They really do.
Yeah, I was going to ask you, do you have to have a certain background in nursing to only take on those particular cases, or can you kind of go across the board?
You can really go across the board. I mean, I do a lot of personal injury cases, like with traumas and TBIs. But I love neuro, it's my thing. But that doesn't mean I can't do a cardiac case. It doesn't mean I can't do a peds case. I was trained to do all of it. There are most cases that don't necessarily involve triggering events that are like that end up in TBIs that I can handle as well. But one thing that is very respectable, and one thing that a lot of legal nurses do, is that we know when we're not the expert anymore. And we have a network of experts at our fingertips. So why not sub out that piece to get an expert's opinion? I think that's why when attorneys figure out what a legal nurse is and what we do, and then they see what we do and how we can bring so much expertise to the table, really from any specialty, it brings so much value for them. They don't let us go. They're extremely loyal people. But you can have any background in any specialty. So this is how you can think about it. What do people sue for?
Yeah.
It could literally be anything, right? In medicine.
Anything.
And usually lawsuits end in some sort of deficit or damage. There's always medicine involved. So literally anything. You could have any type of experience, and as long as you can find a way to contribute your expertise and really to bring that angle of expertise to attorney clients, there's value in that. There's value in every single nurse. We all bring different perspectives.
Yeah.
Just one of the reasons I love it so much too is it is just, you have this field of nursing, and then you have this whole field of legal nursing. It's like just as big, right? Yeah. It doesn't get any smaller, which is fascinating. Once I discovered it, I was like, oh my God, there's a whole nother world out there. Super interesting. And it's like I said, it was one of those, this seems too good to be true, but no, it's real. It does exist.
How often do you have to go into court, or is it mostly reviewing paperwork and sending them a report and that's it? Or do you have to go in to talk to a judge or the jury? What's kind of the dynamic with the legal system?
So so there's a few things that can contribute to that. You can either work behind the scenes and elect to only work behind the scenes and just do consulting work. And that's what I mainly do. You can also, that's a consulting expert, to testify in court, to be put on the stand, right? To have an appearance, to go to trial. That's a testifying expert. And that's a very different ball game. I would say I don't want to speak for all legal nurses, right? So we all do it a little differently. But there are many legal nurses are either a consulting expert or a testifying expert. It's very hard to mix the two. Things are done very differently. The way you represent yourself is very different, because, as a consulting expert, what you do is non-discoverable. However, as a testifying expert, all your reports and things you document are discoverable. So it's a very different, there's a very different approach when it comes to how you're portraying the case, what you're saying when you're saying it. So different training too. I think really, as a consulting expert, I work with testifying experts. I can help locate testifying experts, not just nurses, doctors and surgeons and radiologists, whatever. we're the ones who are like, you need someone on, you need someone to testify to this. We're the ones who
Yeah.
also help attorneys see that and identify that. And there is another perk, right?
Mhm.
And I can help you locate testifying experts. And attorneys are like, geez, awesome, great. Send
One
me
less thing
some,
for them to worry about.
Yes, and that's really one of the beauties in it is,
Mm.
someone's asked me, well, they have paralegals who can do a lot of that. You're right, they do. However, a lot of paralegals would like to also do the legal aspects of things and not be sucked into some of the longer drawn out processes like writing chronologies and reviewing medical records or paginating and organizing medical records.
Mm.
That's very difficult for some people to do.
Yeah.
I receive records all the time, and see, as a nurse, we think this is so easy, right? It's
Yeah.
easy to organize a medical record. It's not for someone who doesn't do it. I
Mm.
receive records all the time and they'll say they're already organized. Well, now my clients know they're usually not organized. There's usually missing because it undoubtedly, I always get an incomplete medical record. There's
Mm.
always something missing, but they may not notice that. And I'm going to say there's an event that happened here and it's missing from the
Mm.
record. We need to
Yeah.
request this specific date of events. And they're like, I never would have known that. And that's okay. That's
Mhm.
just what our eyes are prone to, right?
Yeah.
That's what, like I said, we are nurses. We build the medical record.
Yeah.
So we have sight for that. That's what makes this. There are challenging aspects to legal nursing, but I think that's what makes this so easy in some
Mm.
aspects. Like you're already doing it.
Yeah.
It's just how do you translate that into legal nursing and how it can help benefit your clients.
Yeah. Did you have to go through special training or certification in order to become a legal nurse?
I did go through training. You don't have to. You do not
Mm.
have to have a certification. I like for people to think of it like this. I was a trauma nurse, but I
Mm.
didn't have a trauma certification to be a trauma ICU nurse, right? I worked in
Yeah.
critical care. I got trained. I got mentored.
Mm.
I got coached, right? I had
Yeah.
an orientation period. But I didn't have a certification at first. I didn't.
Mm.
Eventually, I went and got one for critical care and things like that. But that was my own personal desire. But you don't have to have it.
Okay.
And some people think, and actually there's only one real certification out there by the AALNC. There are a lot of
Mm.
other certifications. They may or may not be nationally recognized. Some aspects of legal nursing, you may want to consider getting a certification. It's becoming
Mm.
a little more popular upon demand. If you want to be a legal nurse and actually work for a firm, like employed as an
Mm.
employee of the firm, that becomes where I see it being a little more in demand, or where firms are kind of
Gotcha.
looking for that in a job description or on a resume.
Mm.
That background, you know what I mean?
Yeah.
Versus owning your own business like I do. I have never once had an attorney ask me what my certification was.
Wow.
It's about my medical knowledge. It's
Mhm.
about all of my experience and everything I bring to the table. And and that is not a legal certification at all.
Yeah.
That's not what they're paying me for. They have the legal certification, like that's them.
Mhm.
Attorneys who are like ask me questions, and I'm like, dude, you do the law. That's you. That's your ballpark, right? That
Yeah.
you do law. I do medicine. I'll interpret whatever I can for you, but that is out of my jurisdiction. But that's how integrated they are.
Mm.
That's how broad it is. That's how much opportunity there is. And just like I said, you can do legal nursing in a few different ways. You can be employed for a firm. You can subcontract with firms and own your own business. That's what I do. But I also subcontract to other legal nurses,
Mm.
and other nurses subcontract to me. So you can
Okay.
see how there's a back and forth. It's not one or the other. The
Yeah.
real dynamic is going to be, do you want to work for yourself, or do you want to work for someone else?
Mhm.
And do you want to consult behind the scenes, or do you want to testify?
Yeah.
And consulting behind the scenes, there can be traveling if you want to do like DMEs, right? You have to
Mm.
go to the location where they're doing the medical examination,
Gotcha.
be a part of that, right? You have to actually be present for the
Mm.
examination. That is exactly what DME services is. So yes, there can be some travel, but the pandemic has done a wonderful thing for the field of legal nursing, and it's pushed everything online. Like, dude, I work from my house. Like you see it. This is my office. I get the glory of working from home. I don't have to just stick to my location for attorney clients. I work with attorneys across the nation. That is the beauty of legal nursing right now, is you can literally work for any attorney anywhere in the country from your own home or from an office. That's your choice, right? From the pool. I mean, that is the beauty of having your own business. You don't have to go punch a time clock, right? But there is a caveat to that too. Like being a business owner doesn't come with ease. There's a lot of structure, a lot of knowledge, and a lot of experience has to come with that. And there's a whole nother side of it. Like, I'm a legal nurse, now I'm a business owner.
Yeah.
And but the freedom and the flexibility that come with that.
Yeah.
That is how you maximize gaining all of that, the flexibility, the freedom, the ability to literally work when you want, however much you want, on what you want. Like, you have complete control over everything, right?
Yeah.
And if you subcontract out too, like working for other nurses, I love subcontracting with other nurses because it keeps that open line of communication. And again, we're all experts in different things.
Yeah.
Like, we don't know everything. And so, yes, I love being part of a network. I enjoy everyone else's brains. I don't know. I just feel like we're smarter and stronger together. You know what I mean?
Yeah.
So that's why I love the network part of it. So there's a few other different dynamics, I think, in legal nursing. Some people who actually do subcontract with firms, but go in and have their firms or their clients in a specific like radius or location, something like proximity.
Yeah.
You can do that, but you don't have to. So I think this is kind of the part where some people think it gets confusing because you have a lot of options.
Yeah.
And because you have the freedom to really create your options, sometimes people think there's too many options. And I felt like that too, in the beginning, but this is what I have to tell nurses. Like, don't let that overwhelm you, because when you walked into nursing, did you not think the exact same thing? Too many options. What am I going to do?
Yeah.
This is the start of that again. It's just rediscovering, what do you want to do? And you don't have to be limited. Some people say, well, I don't have a specialty. I'm a big believer in specialties. Yes, you do. Every nurse believe it or not, med surg is totally a specialty, guys.
Yes.
Like, every single aspect of nursing is a specialty.
Yes.
It really is. And nurses, I hear it all the time. Well, I'm just a med surg nurse. And I'm like, are you kidding me? I need med surg nurses. I don't do GI cases. Like I need med surg nurses who understand this stuff.
Yeah.
I am a critical care nurse, right? All ICU background. So I need that perspective. And I love contracting with med surg nurses. Managed care, people who work in nursing homes or assisted living facilities, skilled nursing facilities, home health care nurses. I mean, it
Whole
goes
different world.
It is every aspect of nursing really has a facet and a place in legal nursing. It does. And then some, honestly. I think that there are even like a few additions that I probably can't think of on the top of my head, but they'll come to me.
So we talked a lot about really great aspects of legal nursing, but everything has pros and cons. And I think part of it, which you kind of alluded to, is if you're a legal nurse, unless you're working for a firm, you're running your own business. So that could potentially, has pros and cons as well. Because when you are having to build your own business and then make that your livelihood, there's some difficult times that can come along with that, and challenges in itself, because you're not clocking in, clocking out, and getting a paycheck. Like, you're going to get it yourself.
So there's multiple ways to look at that. First, I want to start with the fact that it doesn't have to be all or nothing. There are lots of legal nurses who actually do legal nursing on the side, and they still work in the hospital. In fact, that's a majority of legal nurses. They still work PRN in the hospital. And it's not, when nurses are looking for something else and they feel burnt out, those are the symptoms, and they're just out of alignment, really. And being able to do nursing in a different way and get the gratification and the value that you desire, all of a sudden bedside nursing becomes appealing again because it's a choice, not an obligation.
Yeah.
So I get to choose to work PRN or part-time and stay at the bedside.
Mm.
And I get to I get to enjoy this other aspect of nursing, which is legal nursing.
Yeah.
So you can do it in any way, shape, or form. There are nurses who work full-time and do legal nursing PRN
Mm.
by choice. That's what they want. They want it as a side gig. They want it as supplemental income. You have the ability to do that. There are nurses who decide to completely quit their jobs at the bedside and in traditional nursing and do full-time legal nursing.
Mm.
You can really take it to any part of the spectrum that you want. And even, people talk about, oh, I don't know anything about business. Well, there's a lot of nurses who subcontract directly from other nurses.
Yeah.
And so the business element really can be as light or as heavy as you really want, you know? If I subcontracted from 4 or 5 other nurses, and that's what I chose to do, and that's what I wanted to do, the business aspect of that is really just a billing and invoicing to get paid, right?
Yeah.
Not necessarily having to go market myself to attorneys. So I do have to market myself and have great work product for the people I subcontract with.
Yeah.
So there's different elements of it. The con to that is subcontracting is less pay.
Yeah.
The pros to owning your own business outright and having the attorney clients directly is it is the biggest bang for your buck. You get the most money.
Yeah.
And the most freedom and flexibility. But yes, that comes with the weight of owning your own business, but it's not difficult. It's just like legal nursing and nursing once you figure it out. Like I guess it's just learn about it, right? Nursing was intimidating until we learned about it.
Yes, very
Right?
much
Legal
so.
nursing is intimidating until you learn about it. Starting a business is intimidating until you learn about it. And then sometimes I'm the person who's like, just do it, right? Because if you desire and crave so much so that flexibility and freedom,
Yeah.
you will find a way to make it happen. If you desire to be in-house and part of a team, work in-house. The pros to that are a paycheck. People bring you cases, right? You don't have to go out there and do that. You get to go to work. Some people really love to go to work, right?
Yeah.
They like to get up and go. And that's awesome. We need people like that. The con to that is the pay, right? And then I still have to punch a time clock and I don't really have flexibility. I still have to go probably 8 to 5, Monday through Friday. And I'm not saying that's it, right? There are some firms who are, maybe Monday to Thursday or whatever that may be. But the main structure of that really is that you don't get away from the traditional aspects of being an employee. So you still have your obligations there. And then also the pay is less. But again, then you swing completely opposite end of the spectrum. And it's the same way it is for other business owners, right? That's where you make the most money. That is a completely different ballgame if you want to do it full time and make it your full livelihood.
Yeah.
Doesn't have to be though. And that's the beautiful thing about legal nursing is it gives you an opportunity to enter into another field without having to completely leave nursing, right? That is the beauty in it is you can start your legal nursing career PRN. You can do it on the side. You can do it part-time. And then if you get into it and you're like, I really want to grow. I want this to be my main gig. You have the ability to do that.
Yeah.
You can go PRN in the hospital work. I mean, there's so much flexibility in the combinations of how you do it. If you want to mainly subcontract for other nurses, you can do that.
Yeah.
I don't always recommend that. I tell people if you're going to subcontract, you might as well go after your own attorney clients too, because you're going to do the same work.
Yeah.
You just get paid more. So you see, there's always a pro and con. Go after the attorney clients, get paid more, do the same amount of work, or be a subcontractor specifically. And you don't have to go after attorney clients. You get paid less. And then the other downside to that is you don't really have control over how much work you get, right? Someone else is controlling how much work you get.
Yeah.
And so that's why legal nurses typically do a combination of things.
Gotcha.
And they do a combination, some are consulting and do DME, some strictly do DME, right? And then that is I think the most beautiful thing about legal nursing is really you can do it in any combination. But that's also the overwhelming part is because there are too many options.
Yeah.
And nurses are like, oh, I can't pick, right?
Yeah.
I'm not even going to because there's too many options. I feel like, sometimes it's when you walk in the grocery store. And for me, it used to be, I'm saying this, it used to be like going down the toilet paper aisle and I'd be like, why are there so many different types of toilet paper? This makes no sense to me.
Yes.
Shell it down a little bit. But then, you have nurses like myself who can help you do that, who can help you really narrow it in and ask you specific questions that'll gear you towards, like, what do you want? Okay, this track will help you get there. Taking this route will help you really get where you want to go. I have interviewed lots of nurses to find out that they should be testifying experts. That's what they want to do. And so, I know testifying experts. I know someone who actually trains testifying experts. So, hooking them up with that network and pointing them in the right direction. Just like it happens with nursing. Just like when you go or start out in a unit, you're like, this isn't my jam. I want to go to OR, right?
Yeah.
You usually take direction and guidance from another nurse or another legal nurse. Much of it mimics exactly what we do. Yeah. In traditional healthcare. The beauty and the biggest benefit of being a legal nurse is the fact that you have another opportunity. Yes. And another world you have access to, and then additional flexibility, freedom of choice, you know what I mean, to do what you want. Yes. When you want. Well, thank you so much for diving deep into what a legal nurse is and talking to us about just the world of nursing and business and being able to open up opportunities that we never thought possible. Oh, absolutely. I enjoyed it. Thank you for having me. Of course, we'll have to talk again soon. Yes, I appreciate it. All right, girl.
Life is a winding road, no telling where it goes.